What's up with it? We are live. Okay. It's Talk to Me Tuesday, baby. It's Talk to Me Tuesday. Okay. And this is our Empower You Period segment where you know, I answer your questions. I answer your questions that I receive by way of pop-up shops and in these streets, okay, in my inbox. And tonight is conversations about endometriosis. So y'all give me a minute. I am going to invite our guest on. So hold on, hold on. I'm so excited to have her here. So y'all just bear with me while I get her together. Okay. Hold on. Let me get her set up on these different sides. Now I'm new to this streaming and stuff, so y'all gonna have to bear with us, okay? Bear with us because this is not our section, honey. Okay, we are absolutely new to it, so it took us hours to pull this together, but we are here and we're excited about it. We're excited about it. Tonight is a very important conversation, and I get it often when I'm in these streets. So I am blessed to have the opportunity to bring on, you know what I'm saying, an actual MD in the field. Okay. Honey, she is out here in these streets and community helping us get it together. So she's going to be able to come on and share her wisdom about this topic for tonight and answer some of the questions in which I have been receiving. And yeah, I'm just excited that y'all going to be able to get it from the doctor herself. Okay. So just hold on. I am inviting her now. Let me make sure I got her login right in 878. Okay, okay, I think I got everything right. So give her a few minutes. She's going to come on, and while she's doing that, I am setting up these other devices, honey. I got to get on all these different, you know, social media outlets. Y'all know we kind of up in age, honey. This a little bit, honey. This a little different. This a little different. Okay, so hold on. I'm trying to be able to maybe. Oh, okay, okay. There we go. Okay, okay. There we go. Right there. Okay, so I'm able to hold it right there. All right. I just sent that link to Dr. Alsabrook. And here you go, baby. Child, my son is trying to help me get it together. Okay. Thank you so much, dear. Oh, I hope they don't knock all the lights out. Take something out, take this out, and unplug all of that except for my laptops. You can unplug everything. I apologize, y'all. Bear with me now. Bear with me. Okay. Let's see. Not that one. Okay, we took the light off of the camera. All right, all right. I think we have Dr. Also Brooks on. Let me um, let me bring her in. There she is. There she is. I am adding to the stream. Hopefully, I did it correctly. Okay. No. All right, girl. Well, look, we got technical difficulties. Girl, the light didn't went out over here. Honey.
Oh no, that's all right.
Oh, I think there is light, honey. Ain't that what Jesus said? Let there be light. Okay. Whew. I got nervous for a minute, child. Okay, so. Oh, it did. Okay, so let me just go ahead and unplug that because we don't want to catch on fire. Okay. Oh, that's what it was. Okay, we'll just. Oh, okay. Well, let's just throw that away. Just unplug that. All right. We're allowing access to devices. So we are here on YouTube. Okay. As I said before, thank you all for joining us this afternoon. Bear with us, okay? It took us hours to get this, put this thing together. Okay. So hopefully we're gonna be like all to the good. Give us a minute. We're gonna jump in and pull up on the Instagram side up next. Thus far, we are streaming live from Facebook and YouTube, and now to we're gonna go to the gram. We're gonna go to the gram. How you feeling, Dr. Asa Brooks? Y'all all right over there?
We all right over here, feeling good.
Hey now, hey now. Okay, okay.
H Town.
Hey, going down.
Yes, H Town.
All right. Let's see where we at. Yes. Okay, cool. We are set up. Good evening, BGM, Black, Grown, and Married. Okay, we're in the group, honey. We're in the group. We are set up. Good evening, BGM. All right. I'm just checking the hot spots. Okay. So we're all good in one of the Facebook groups, and then let's see if we're on the personal side. Okay, let's see what we got. Okay. I don't see us on that personal page, but no worries. We're gonna make this thing do what it do.
Yes, we are.
And so we are also streaming live from the website, empoweryou.com. If you want to show your face, you are welcome to join us on that side. Let me see if I can get Dr. Oxelbrook over there. Also Brooks over there. I think that one may just take a little more managing, Doc. So honey.
Which one, the Instagram?
No, girl, this on the website. They don't look the same like we had it earlier. Okay, honey.
Oh.
Yeah, it's not giving us our links. You know how we were like dual setup?
Mm-hmm. Oh yes, we practiced this, guys.
We did. Okay.
Setup.
Well, honey, it ain't giving us our dual screen. We're just gonna charge it. We don't have people ain't logged in over there. I'll leave it up just in case somebody comes in so we can redirect them here to the YouTube side. I've already put that in. So we're going to go on and jump over to the Instagram side. Let's see if it's going to let us. All right, we got our comments and things set up. Hey, Arthur Vance. Thank you for chiming in, sugar. So appreciate you stopping by.
Got that family support. Hello, also Brooks. Appreciate you.
Yes, come on now.
See you on Instagram.
Look here, once y'all come in, as we're getting these tech things together, okay, drop a comment. Let us know where you are chiming in from. Drop your city and states in the comments, okay?
Yes.
Drop the state in the comments so we know where you're coming from. All right. All right, we're going to move on to the Instagram side. I'm about to bring you in right about now, sis. Hold on. Checking connection. Okay. Okay, there we go. We are Instagram live. I am bringing you on now.
Perfect.
Give me a moment. Okay, the doc also. Okay, there we go. Like and follow. Okay. Live. I am bringing Dr. Also Brooks.
Yes.
The doc also.
Yes.
All right, I just waved you up, girl. Hey.
There we are.
Okay.
So
echo on your end.
Say again.
Can you hear echo from me?
I heard one from me too, so I had to just turn everything down.
Yeah. Okay.
Can you still hear me? Okay.
Yep. I can hear us just fine. All right, we're gonna give a few people time to come in. I'm gonna share this out a little bit. You know how Instagram likes to show up and pull the people together. All right. I'm new to the YouTube side, so Chad, let's see what happens. BGM, if you are here, make sure you are dropping your comments. Okay. Mr. Also Brooks, let us know if anybody got questions on that side. You drop it on the YouTube side. Oh, we are whistling. I don't know if that's my side or your side. Mr. Also Brooks, thank you for joining us, sugar. I can't see the BGM side. So if you can see that side and they got questions over there, drop them this way. Okay, honey. Okay. All right. All right, I am letting the people know we are live. Okay, okay. Ooh, it's whistling. I can only hear that back sound on the Instagram side. We seem to be all clear over here on StreamYard for YouTube and Facebook. Can you all hear the background noise? Okay, that's better. Whatever you did right there sounds much better. All right, honey, I have invited several people. I'm trying to catch a few of those babies who actually posed the questions to me, or to us rather, to give them the reminders that we're on. Okay. Y'all will see me looking back and forth. I'm working like 2 cameras 3 times. Okay. 2 cameras. Okay. All right, all right. It doesn't look like we have anybody on this side, so I think I'm going to shut that side down. Hold on. Y'all bear with us now. I'm telling y'all it's going to be good, honey. It's going to be good. You don't want to miss this, so be still. Okay, patience is a virtue, and virtue won't hurt you.
That's
Okay.
right. Be worth the wait.
I don't think you can ever really prepare for these things when it comes to this tech action, child.
We rolling with it.
Absolutely, absolutely.
I think the noise may have stopped. Motivate your room. Can you confirm? Are you still hearing the noise?
Hey, Momo, what's up, girl? Thank you for joining, Mo, honey. Y'all, Mo is my poo, honey. That's my poo right there, honey. She got me right on together, honey. She is the inspiration, okay? Y'all make sure y'all check out and follow Motivate Your Womb. Okay, WOMB. Make sure y'all like and follow Motivate Your Womb. She's on Instagram and Facebook.
Awesome.
All right.
Yay.
All right, all right. So we're gonna go ahead and get this thing going, okay?
Yeah.
Welcome, welcome, welcome to Talk to Me Tuesday, baby. It's Talk to Me Tuesday. Okay. You know, this is where I let y'all ask questions and or I'm answering them. I ain't gonna say and or I'm answering them. Okay? Okay, and see, tonight is such a deep topic that I had to bring the specialist in, honey. She specializes in various areas, honey, with various specialties. Okay, tonight our special guest is Dr. Carissa Also Brooks, MD of Benny Health, Wellness, and Aesthetics, honey. Tell people hi, Doc. Also,
hello, Dr. Also Brooks here. Thank you for joining.
So let me go ahead and give y'all this disclaimer. Okay, I am not a doctor. She is, but I ain't. Okay. I'm not a doctor. I am just a woman with experiences, honey, and who knows other women with experiences too. Okay, and this topic is so in depth, it's so deep. I get it a lot of times when I'm out here in these streets, and I answer it to the best of my ability and what my understanding is. But I wanted those things to be reinforced and even elaborated on, which is why I brought in Dr. Also Brooks. Okay, she's straight out of Houston, Texas area. Okay. Okay, so the doc is, I mean, like she gonna be the specialist tonight. Okay, I'm just here to facilitate. I'm here to throw out the questions that I've received from you all, and she's going to get an answer. So I'm so excited to have her. I just want to throw that disclaimer out there. I'm not the doctor. She is.
Yes.
She is. And this is Talk to Me Tuesday. Y'all got questions? If you did not make it to my inbox, you did not run into me in the streets, drop them in the comments, honey. Drop them in the comments. That's what you do. Okay. So yeah, we're gonna move on into this thing. Dr. Also Brooks, if you could just give the people a little brief history about yourself, where they can find you from, and how long you been doing what you do.
Well, I am Carissa Also Brooks. I am a board certified family physician. I see lots and lots of women. I've been in medicine for, wow, almost 20 years now. That's a long time. So, but
Come
yeah,
on now.
20 years. So I came to Houston for my training and pretty much stayed. So I've been here a while. And I see a lot of times women come to me and they haven't shared with other people because they don't feel comfortable. So I found myself in this conversation often. So we were talking about those different things that we experience from that side of education, and then also from the side of treatment. And we just feel like this is a good platform to bring that to everyone so that we can have this discussion and you can get some questions answered that you may not have felt comfortable asking your doc. So I'm here for that, all for that. We just want to make sure that we have that discussion. I am not a gynecologist, but trust me when I tell you, I see a lot of women's issues. I know when to pass it on, and I know what I can handle on my own. But I have that time, and I have that drive, and I have that passion and desire to make sure you understand about your body. So we want to make sure that we do that. And if you're ever in the Houston, Humble, Kingwood, Atascocita area, I have a clinical practice there, Bene Health. Bene Beyond, that's our new name, Bene Beyond. And so we take it beyond that initial primary care that you get. So we have a direct primary care practice. And so we'd love to see you all if you're ever in the area. That's benebeyond.com if you want to look us up. But I'm going to pass it back so we can get into this discussion.
Absolutely. Okay, so I'm looking at, most say that there's an echo. Justine, are you hearing an echo? Let us know. We're gonna try our best, but we might have to push through, honey. We might have to push through. Okay. Might have to push through. So just put it down in the comments and then we'll try to work it out as we go along. I can't make no promises, honey. It took us this was a hard road to toe just to get to this point. So we're gonna just jump right into it. This is again a really important conversation. Let's talk, period, honey. The new normal. Let's talk, period.
Yes.
Okay.
Naturally.
Endometriosis is again, it's really important for us to have this conversation because it's kind of like the silent illness. From what I've learned over time, and also with speaking directly to Dr. Also Brooks, it can go undetected. It can go under the radar.
Mm-hmm.
There's like at least 10% of women, okay, will most likely experience endometriosis. Mm-hmm. So that's why it's like we got to have this conversation. And I'm not going to go into, you know what? I think we're going to, how you want to do this now? You want to just kind of Q&A this thing? You a couple of questions, or you want to just jump right in? How you want to do this?
Well, I'm gonna jump right in first because there's a couple of things that I definitely want to say, and then I think we need to go right to the questions. So let's do it. Okay, first of all, I want to explain what endometriosis is. Sometimes there's a misunderstanding about what endometriosis is, so I want to break it down. And I like to put things simply. I'm the first doctor in my family, so we try not to speak doctorese. We try to speak English.
Well, hold on, Doc. Hold on. The people saying they're getting the echo. Hold on. We're gonna fix this, y'all. We're gonna try to fix this.
Okay.
But we're gonna look here. We're gonna do the best we can do. If it don't get any better, y'all gonna need to come to the YouTube side. Okay. Look, honey, I told y'all this wasn't no easy task. Okay, so if the echo doesn't improve, y'all gonna have to go to the YouTube side. Okay. Oh, y'all can still hear echo? Drop it in the comments, honey. Drop it in the comments. And if so, if you can still hear the echo, is the echo so bad that we can't keep going? I think it's because we got all these mics on. We got computers up. We got cell phones up.
Like I'm at the news
Okay.
studio with all the mics and cameras.
Yes, Comedic Yogini. Yes, that's my baby. Y'all follow Comedic Yogini, honey. Hey, Shamika, what's up, boo? Okay, hey, girl. Appreciate you chiming in, honey. Appreciate you chiming in. And absolutely, let's be here for the convo.
Yes.
Okay. Now y'all know I'm working 2 cameras. That's why y'all gonna see me going back and forth like this, like that. Okay. All right. So can we keep going? Can we keep it going? Okay, good. You can hear the doc. All right, we're gonna make it do the best it can do. If all else fails, y'all go over there to YouTube. Look me up, okay, on YouTube side. I'm gonna tell y'all what the link is. Hold on. So that way everybody can just have access if this echo becomes too much. We're gonna jump right back in because we know Instagram will shut you down. Okay, hold on.
Oh.
Hold
Thank
on.
you, Yogini.
All right. Okay, I'm gonna try to. So what we're gonna do? We're gonna just keep going. We're gonna keep going while I look up the link to drop out here. We're gonna go ahead and go for it. So Doc. Okay, look, I'm over here on that Doc also, honey. Okay, Dr. Also Brooks. Okay.
Yeah.
Just carry on, sis, and I'll look for the link to drop over there. Let's keep it going.
Sounds
right.
good.
Bear with us with these tech difficulties. And thank y'all for chiming in.
Yes.
Appreciate that.
Yes.
Go ahead, Mama.
All right. Well, endometriosis, first and foremost, what it is simply when the cells that are supposed to be inside of the uterus get outside of the uterus and cause pain and inflammation. So why does it matter? It matters because those cells are designed to respond to your hormones, and they're designed to grow and change and sustain life and respond to all of those different signals that your body puts out. And if they get in the wrong spot, then it can cause pain and inflammation and changes in your body that you can feel, but we can't always easily see. So that's one thing. So endometriosis is not just cramps, because sometimes, people think, oh, it's just, you got bad cramps. No, no, it's more than that. It's the infiltration of cells in places they should not be. So
Doc, is that like, so it's like what you're saying is like these are runaway cells.
Exactly.
They ain't where they're supposed to be.
They are not.
Go all over the place.
And it can go anywhere. So it's not just in the pelvic area, although that's where it's most commonly found. It can go to the rectal area, the abdominal area, even the lungs. So, but yeah, they can go anywhere, and it can cause problems in any of those places. So we have to make sure that we're aware about what endometriosis actually is. So
yeah, them cells just take off. Just do what they want to do. Yeah, I know they shame. Go ahead, Doc. Go ahead.
So the hallmark of endometriosis is pain and inflammation. And so that's usually the symptom that is going to be reported. So if you are having pain in your pelvic area, usually that's where things start. You could have pain all the time. You can have pain in cycles. You could have pain with your periods. You could have pain during sex. You could have pain just in general. And so a lot of times when your hormone surges, this pain will get worse. So that's why we see it a few days before your period, all through your period, and then even after your period. That's usually when the pain tends to be worse. And it can be debilitating, not just like, oh, I'm hurting a little bit, like can't get out of bed hurt, like crying. Ugly crying hurt, those kinds. So that's why it's important to have the conversation. And it's important for those of you that may not have endometriosis, but maybe know someone, have a loved one that has it, to be an advocate for that patient, or to make sure that you're an advocate for yourself. Because a lot of times, and I'll just, I'll own it as part of the profession as doctors, things that we can't readily diagnosed with a blood test You know, if we can't see it, pain is really subjective. Something that may hurt me a lot may not hurt you that much. And so we can't see it unless we're looking in the right way. And we'll get to that. A lot of times it gets dismissed. And so you have to be an advocate when you're going in and you're talking to your doctor if you're having pain. And you might not be having pain the moment you're talking to your doctor. It might have been a week ago, 2 weeks ago. But that's something that needs to come up in conversation because it needs to be explored.
Did y'all get all that, honey? You got to be an advocate for yourself and others, you know, like the women and girls that you love. And this also plays into one of my questions, Doc. Is there such thing as you're too young to have endometriosis? You know, like, can teenagers have endometriosis?
For sure. Yes. For sure, teenagers can have endometriosis. Even postmenopausal women can have endometriosis. It's commonly found in women that are 25 to 35, those height of the childbearing years, but it is found even in adolescents, even in postmenopausal women. Remember, endometriosis is simply cells where they're not supposed to be. And that could be at any time when that uterus gets active.
So, you know, one of the topics that I put out there as one of my little headlines for, you know, to grab the sister's attention is that, sis, it may not just be a bad period. Okay. So is there such thing as early detection? You know, I understand now when it comes to the pap smears, or, you know, for the young girls, that they don't have to have that done until what is it, like early 20s or something?
Yes, that's correct.
I grew up, you had to get that, you know, once you started that period and stuff, honey, you had to go get that women wellness that included the pap. Mm-hmm. But, you know, after speaking to you, Dr. Alsa Brooks, I understand that there is a difference between the pap smear and the women's wellness. Is that right?
Yeah. That is correct.
Let's school the people on that. Let's just start that. Yes. Tell the people the difference between the one wellness exam and the pap smear. Mm-hmm.
So the pap smear is simply a test to check for cervical cancer. That is it. It is where we get cells off of the cervix and send them to be looked at under a microscope. Nothing more. The well woman's exam, or any wellness exam, really should take into account a lot of things. Number one, we look for opportunities to screen you for anything that we need to screen you for. So we look at your personal history, your gender, your genetic makeup, your family history, any other risk factors that you may have had, like smoking or other habits. And then we see in that wellness exam, that's an opportunity for us to determine if there's anything else that we need to screen you for. So I get the question all the time, like, okay, what can I do to check and see if I have cancer? You need a wellness exam, because that's when we're going to go through all of your history. We're going to go through all of your issues, your medications, your family's history, and we're going to see what do we need to screen you for. And not everybody gets the same screening. Now, there are a lot of people that get a lot of the same screening, but I have a family history that some of you all don't have. And so there's things that I may need to be screened for, and at different times. And so with regards to the pap smear particularly, we used to do, I like to say, when we know better, we do better. So back in the day, we used to do pap smears pretty much as soon as you had a period or you were sexually active, you got a pap smear. And what we determined is that we were subjecting women to a lot of unnecessary procedures, because we were finding things that the body was going to take care of on its own if we would have just let it be.
Like superpowers to me.
Yeah.
That girl got superpowers.
What we did was we said, look, you know, we don't need to start screening that early when we're just screening. Now, I will make this disclaimer. Diagnostic testing is different than screening. Screening simply means there's nothing wrong, but we're going to check just to make sure that we don't need to do anything else. Diagnostic means there's something wrong and we need to figure out what it is. So if you're having symptoms, we're no longer talking about screening. If you're not having symptoms, that's what we're talking about screening. So pap smear is a screening specifically for cervical cancer. It does not check for ovarian, endometrial cancer, uh, nothing else. It only checks for cervical cancer. And so that's why it's the pap smear is different than the well woman. The well woman is it's your whole body. And I say my phrase, every human needs a wellness exam every year, at least. Every human, every year. So you may not need a pap smear, especially if you don't have a cervix and you've never had any history of abnormal pap smears. But every human needs a wellness exam every year.
Okay. So we're gonna take that and we're gonna back it up. So if I have a teenage daughter, right, and like she has a very bad period, we got heavy bleeding, well, you know what? Let me redirect. One of the questions is, and I think this may answer the question about how to help teenagers, okay, be able to identify what's happening with them. What are some of the symptoms of endometriosis? Like, what are some of the red flags that say, hey, you might want to get that thing checked, girl?
Number one, pain. That is the number one symptom.
Like when you say pain, is it like 1 to 10, like 4, or is it like 10 plus?
It can be 4. It can be 1. Well, 1 is no pain. It can be 2. It can be 10. But if you're having pain, then we want to investigate and see what it is. Most of the time, I like to have a relationship with my patients. This is why, and I'm putting a plug right now. Everybody needs a primary care provider. Okay? Everybody needs a primary care provider. And
that's why you're here, boo. I'm trying to put the people on.
Yes, everybody needs one because I know my patients. And if my patient that tells me they toenails itch and, they skin feels weird and they tell me every little detail tells me that, something is bothering them. I know that that's different than my patient that never, ever complains. And they go, I'm kind of having some pain. That patient that never, ever complains and tells me, I'm having some pain, it's probably would have been a 10 out of 10 for me, And so I know that about that patient. And I know that even if they're not making a big deal out of it, if I know their character and I know how well they can tolerate pain and they're bringing it up, and I've even told patients, I know you have a high pain tolerance. So you're saying it's not a big deal, but I know it is, and I'm going to check it. And a lot of times they're relieved because they didn't want to bring it up. So me going, I don't like when you say I'm having some pain. So that's why you need somebody that really knows you, and they know how to deliver news to you. They know how to assess you. They know when to reassure you, and they know when to dive in and do the diagnostic work. So pain is the hallmark symptom. And if you're having pain, and not just while you're in the doctor's office, I cannot stress that enough. Not just while you're in the doctor's office. If when you're having sex, you're the ooch ouch girl, and you way and stuff like that, that's not supposed to happen unless it's just really, really rough. But that's not supposed to happen. And so if sex has become painful, that is something that needs to be discovered. If you're missing days of work because your periods are so painful, that is an issue. If you're not going out because your periods are painful, that is an issue. If you start having weird symptoms in your bowels during your cycle, that could mean that there's endometriosis present. And so I know you don't necessarily know to bring these things up, but that's why it's important to have conversations that last more than 5 minutes with your doctor.
Absolutely. So pain is one of them. So if we're having discomfort during sex, and that's not something that typically happens for you, and or it is, like you could be new to it, okay? So if there's discomfort during sex, if it has you, bent over to the point, like your body has you hurting and you're missing work and you're missing school, when we're dealing with like that type of pain, that could be one of the symptoms. Are there others?
So one of the hallmarks that people talk about is really just infertility, and that's a late sign. you know, and that's why we want to really get to endometriosis early, because what we don't want to do is find out that you had endometriosis and that's why you can't conceive. So
Okay.
that's an important thing to make sure that you bring up is fertility. And we need to think about it even earlier than we thought about it before. Some of us feel like we can have babies. We Janet Jackson, everybody's not having babies when they're 50. So
Yeah.
there's a time limit on that. You know, all of us ain't Sarah from the Bible.
So
So
one of the questions was about infertility. If
mhm.
I have endometriosis, okay, can I still have children?
You can if we get to it in time, for sure. So we want to stop the inflammation that does block the tubes and prevent ovulation or make the uterus an inhospitable environment. But the only way that we can do that and intervene is if we know that it's there. So that's why it's important not to just let pelvic pain be dismissed in doctor's visits. If you're having pain, you got to advocate. So what are we going to do about the pain? Okay, what if it doesn't go away in 2 months? Okay, what if this medicine doesn't work? Those are questions that need to be asked. I need to know when to circle back, not just, okay, you just gonna have pain. That's not an answer.
Okay. All right. So there y'all. So you can, you can have children if you have
Mhm.
endometriosis. And I just want to go back for the people that are joining us. Thank y'all for chiming in. Tonight we're having a conversation about endometriosis. The doc started the conversation letting us know that endometriosis is pretty much like runaway cells that are moving outside of where they ought to be. Okay, they just showing up in different places in the body, and that's what causes excruciating pain for some of us. You know, as we're moving through our trying to have our daily living. Okay, and so that's kind of like where the conversation is going. So to that last question, oh, and then I think too, also in addition to it being runaway cells, these cells cause inflammation, right, doctor?
Exactly. They
Because
cause
they get to wherever they want to go, it's like they start blowing up on us. They start causing problems. Okay.
yeah. That inflammation is very painful, and that's usually the sign. That's usually the symptom that we see is the pain.
Okay. Great. Another one of our questions was, what about heavy bleeding? Is heavy bleeding also considered a side effect, or should I say, a response from endometriosis?
Now, endometriosis can cause some hemorrhages, like microscopic bleeding, and that's why some of the uh, that's why when we look with the scope, because that's really how we diagnose it, is we look with the scope. Um, that's why some of the images look like they do. But really, when it comes to heavy menstrual bleeding, we need to look at other things too, because more commonly it's fibroids, especially in African American women. We're number one. We do that the best. So
Unfortunately.
unfortunately. So that's one of those things where we really need to be looking for the cause, because heavy bleeding can be a number of things. It could be a bleeding disorder. It could be fibroids. It could be anything. So we just want to make sure that we're looking at that.
So another one is, can she get it from her mama, honey? Endometriosis hereditary.
Yes, there is a genetic component to endometriosis. We tend to see this in families. And so if auntie had endometriosis and niecey is having uh, painful periods, then definitely that's something we need to be looking at. So for sure, it can be, and as I mentioned, it doesn't have to be like mama then daughter. It could be auntie, like family clusters, and it doesn't just have to be maternal. So look at daddy's sisters. Does daddy's sister have endometriosis? Okay, well then maybe that's something that we need to be looking at in our daughters. So
So
yes.
pretty much what I'm hearing is that it's not preventative. Like you can't just not, you know what I'm saying? Like you can't just not like not have it. Is it?
Well, one of the things that I like to say when it comes to certain disease processes expressing themselves, a lot of them need a good environment to do it. So it's not just the genes. Sometimes it's the genes and it's the body habitus and it's the diet and it's the all the stuff. So, one of the things that we look at a lot with endometriosis and other types of hormone mediated conditions is, are we getting exogenous hormones? And when I say exogenous, that means I didn't make it myself, I put it in my body. Okay. So, am I getting extra hormones from somewhere? And that could be an injection that I'm getting from somebody, but usually not. Usually it's in our food. And so that's one of the things that we have to look at. I remember this thing stands out to me so much. One of the lectures that I was watching, the doctor said, you know, cow's milk is meant to take a baby calf and turn it into a steer in 2 years. And we drink that and expect not to be a full grown cow in 2 years.
I be
But
trying to tell them about the ice cream and stuff there and that cheese. I be trying to tell them.
yes. And so, and I'm not, trust me, I'm not shaming anybody because, you know,
We all works in progress.
we all are there.
We're all in progress.
So, but
Okay.
as I said before, when we know better, we have to do better. So that's one of those things. If you're having some of these symptoms from hormone mediated conditions, you got to consider, what can I do? Now, there's surgeries available, but who wants to have a surgery every time they have a painful period? I don't. So is there something I could do? Yes, we can monitor what goes in our body and limit the amount of hormones that we're getting. And so if we go more plant-based, that helps us be able to do a bit more with mediating those hormone things. I'm not saying everybody has to be vegan, but I'm saying, you know, limiting those things that we know could be flaring up our conditions. It's really our responsibility to do it and not just go, can I have a magic pill? Because newsflash, there's not one.
So there's no cure for endometriosis, is there?
Well, I would say this: if we limit the signals that can go in, especially if we catch it early, then we may be able to help with that. But there are some genetic factors that may determine if you're going to have, you know, more severe disease no matter what you do. And so also don't want people to be shamed about that. If you've got bad endometriosis, that means you eat bad. No, it doesn't. It does not at all. It means that there's something that your body is responding to, and we just need to be aggressive in how we treat it. That's all. But if there is something more that you can do with your diet, if there's more that you can do to lose weight, because that's the other thing, our own bodies actually produce hormone. The fat cells in our bodies produce estrogen. So there's lots of things that we can do to help ourselves when we get into these scenarios. And one of the phrases I like to use is, he who pays decides. Are you willing to pay the price? And so if you want to determine what it is that your life is about and how your health is, are you willing to pay the price that it costs to be able to get that level of health that you're looking for?
So indeed, so it could be, it can be hereditary. Okay, as the doc said.
Yes.
And I want to go back and just tap one more time. You know, not necessarily saying like there's an all in all cure, but your diet, okay, your diet can ignite the symptoms.
Yes.
Pretty much. It can set your symptoms off. So unhealthy diet can set them symptoms off. Okay. And or with a healthy diet, it could assist in them being dormant almost, to say
Yes.
at least reduce like the exasperation of pain. Okay.
Exactly.
Now I know I might have said that word wrong because I said it kind of fast. Okay.
We with you though.
Exasperation pain. Okay. That's big pain. Y'all know what I'm talking about. You know, okay, so let's see. Let me see, Doc. I'm trying to make sure we got all the questions that were the symptoms. So one of the things that when I often get conversations recently, and it's so wild since we've been connecting and everything about endometriosis, is especially when a woman is having her period, right? I mean, I've gotten like 2 calls recently in the middle of the night about like what they can do. Okay, so look here, Doc. They've already jacked it up. They might have some flaming hot Cheetos. Okay, right before their period got started. I don't know. Okay, you know. And so the sisters that call, they're like in pain. Are there like small things that could assist, like aid with that? Like, do teas help? Like could the warmness from the teas help them relax those muscles so they're not as tense? Does I think what was one of the other things, like herbal teas to help relax them. I don't know. Like, what are your suggestions for the sisters? Like, look here, they in it.
So there are a lot of things that you may be able to do just to kind of ease that pain. And if you want to stay like in a natural kind of frame of mind, yes, there are things that anything that can really calm you, but remember you don't want to have too much sugar. Sugar is inflammatory. So white sugar, white flour, these are things you want to avoid because they're basically like pouring gasoline on a fire. So,
Yes, honey, lights and whites.
so if you're gonna have some tea, make sure you know use a natural sweetener with it, maybe some honey or something like that. But the other thing that you want to consider is even putting a warm water bottle on the outside.
Yes, that's what I was going to talk about. A warming buddy. That's what I'm going to
Yes.
warming.
And so those things a lot of times help relax those muscles that tend to get kind of tensed up when there's inflammation. The other thing that you may want to do is just try different positions uh, that may also give some relief. Remember, these cells can go anywhere. So sometimes you may get those discomfort in the rectal area because you might have cells there,
Mm-hmm.
or it may be in the bladder area because you might have cells there, or it may even be abdominal pain, even higher up out of the pelvis because you may have those endometrial cells there. So wherever your pain is, look for positions that may be comfortable to you. So that could mean that you know you are sitting upright. It could mean that you're leaning forward. It could mean that you are supine, you know, or that means laying on your back. It could mean that you're laying on your stomach. Find whatever position may be comfortable for you. Add a little heating pad or a little warm water bottle. And then, of course, when all else fails, anti-inflammatory, anti-inflammatory, anti-inflammatory. And that's usually when we get to prescribing. We give you some pretty strong anti-inflammatories. And there are some hormone mediated things that can be done. But again, those require prescription. And for people that none of that works, then there's actually surgical procedures to go in and break up adhesions and cysts that are inside the uterus and things like that to help with the pain. But again, you want to try to prevent it from getting to that level.
And so I'll add to that. Red teas are very good. Believe it or not, red teas are good for relaxation, reducing inflammation and things like that. There are various different ones, specifically during your moonshine, honey. Okay, aka your menstrual cycle. Okay, some of them like the blissful yoni herbal womb tea that we carry. It has like really really good stuff in it, like red clover, rosebuds. You'll also see that inside of like some of the herbal pads that I carry. That the roses, that infusion of roses, because honey, it'll get you right on together. Okay.
Mm-hmm.
So yeah, so some of those things we do have in our blissful yoni herbal womb tea, blessed thistle, red clover, rosebuds, lady mantle. So those different types of herb are definitely in our cramp relief tea that we carry at Empower You period. So y'all could definitely stop by the store and check that out. Check out the ingredients in it, and you can also look up those ingredients as well. So that's just when it comes to like that cramp relief and anti-inflammatory, like Doc is telling y'all. It's not a cure for it, okay?
Right.
But it can get you right on together. Little things like incorporating those teas into your diet, okay? Changing your diet, especially if you are a meat eater, okay? At least try to get yourself to a space where you don't eat it as much. Okay,
Exactly.
do things in moderation. Okay, in moderation, people. Okay.
Exactly.
You know.
And
So
so,
we are coming up on the hour. We are coming up on the hour. Let us just recap. For the people who done showed up. And I know, girl, this might need a part two. Y'all think it need a part two? I think it might need a part two. Y'all drop it
we
down.
didn't even touch on diagnosis.
Yes, we did.
We did.
You want go ahead and get to the people. Now, we got 10 minutes. Go ahead.
Well, diagnosis, we need to look with the scope. That's the only real way to diagnose. There is no lab test. Okay, we can't draw blood and tell you, oh, it's endometriosis. So it always needs to be in the back of your doctor's mind if you're having pain, endometriosis. Now, what we usually do is we exclude other things first too, because there are other things that can cause pelvic pain. If you got big old fibroids, those things can hurt. If you got something else going on with your bladder, that can hurt. Different things could be causing the issue. So we evaluate those things because for some of those things, there are blood tests and imaging tests that we can do that will tell us right away if that's what it is. For endometriosis, we actually need to put a camera into the body and look at it. That's how we get to tell if it's endometriosis. And that's something that generally only the specialists are going to do. You don't want just anybody sticking cameras in, because sometimes we have to cut. So laparoscopic procedure is where they cut through the body's wall and they'll go in and look. But there's also something called a hysteroscopy. And that's where they actually kind of put in through the vaginal area through the cervix, and they look. So though you need some kind of scope so that they can tell exactly what it is. And there's a lot of things that as soon as they see it, we're like, that's endometriosis. We can diagnose it on site, but we have to see it.
Dr. Also Brooks, you are dropping jewels tonight, honey. Okay, so look, so if I go to my doctor right now, I'm complaining about these pains and stuff, and and my doctor just tell me, I think you got endometriosis. She ain't looked at nothing.
Mm-hmm.
Then
So
I need to look at somebody else.
No. So your doctor, there's a lot of hallmarks that come with endometriosis, where some people, it looks like you read the textbook because you got every classic symptom. But in order for us to make the definitive diagnosis, in order for us to know for sure, we need to look at the actual lining of the uterus. And then that's how we know for sure. Now, we can even start you on medicine because we're like, I'm pretty sure this is what I'm going to find, and I don't want to delay your treatment. But really, the real is when you look at it. That's how you get the actual for sure diagnosis. So you're not wrong.
She's look, we got the doctor on. Don't y'all be out here self-diagnosing.
Right.
Okay. See the doctor. Okay.
Yes.
Look at this tea gonna help y'all with cramp relief, but look, it is not your. Go see the doctor.
Yes.
Okay. Go see the doctor. You need to know what's going on inside your body. You need to know what's going on inside your body. And this is why I have Dr. Also Brooks here tonight, because I wanted you to hear from her. She's hit us with several jewels. This evening, we've discussed the symptoms that occur, what it is, okay, how to diagnose it, okay, and then how to manage it versus cure it, okay? So, because it can be hereditary. We've talked about how it can be linked to diet, how diet can just set it off. It could just be like flame on with inflammation. Okay, we don't want that. We don't want that.
Flame
off. So be mindful of that. I hope look, y'all need to go back and hear replay on this. Some of y'all share it with your friends. Okay. Please. So I think, Doc, we've hit everything. She has answered the questions, and I'll revisit those questions. Some of them was, can you have endometriosis and live? Give birth. Okay, bring forth life. Yes, honey, but we got to get to it before it gets ridiculous.
Yes.
Okay, so be attentive to your body. You got to listen to your womb. Honey, you got to listen to your body. You got to be in touch with your body. And that's another reason I have Dr. Also Brooks here. She is the best of both worlds. She doesn't just come with the Western world paradigm, okay? She is fluent when it comes to the holistic lifestyle that needs to be attached to us getting better.
Thank you.
So it's not just a one-sided dynamic with her. I've had doctors and they like, going on with all that. Here you go. Take this, do that. But with Dr. Also Brooks, she is fluent on both sides of the paradigm, honey. So she always wants to be able to give you the holistic side. She lets you know, just like she just told us today. She didn't say, look here, if it's that bad, y'all gonna need to go get a hysterectomy. Right? She's telling you, hey, you can curb the symptoms. You can curb the symptoms with a more holistic diet. Okay? And we didn't get to tap on these emotions y'all be hoarding down there, honey. Okay, how stress can inflame. Okay, stress can heighten the symptoms
Uh,
of endometriosis.
stress is hormone mediated, and that is the
Okay,
thing that
she's
flares up.
also right. She's also let us know that look here, teenagers are not too young to have endometriosis. A lot of times, the diagnosis for endometriosis shows up hella late
Mm-hmm.
because we're not listening. We're
Exactly.
not listening to our bodies. We're not asking the right questions when we go in because we're withholding information. Me and her were just sharing a conversation about how it's being discussed. Some of us have no idea that it may be in our lineage. Because
Mm-hmm.
when you go to the doctor, if the doctor diagnoses you with endometriosis, how many of us are really like calling up mama or hollering at our sister, like, you ain't gonna believe this. These people telling me I have. Because something as simple as sharing this information with another sister, you will find out that you are not alone.
Yes.
And that's
Mm-hmm.
another reason, okay, let's talk, period.
Yes.
That's why this has to become the new normal, especially amongst women. This is why I have my Talk to Me Tuesdays, honey, because over here, it's straight no chasers.
Yes.
Okay, it's straight no chasers. You need to know what's going on. And if we begin to have these conversations, we can stop, we can prevent and or at least intervene in various womb issues.
Yes.
We can shut that thing down, okay, before you start. Or at least have healthy ways to manage conditions that exist within our bodies as women. So, Dr. Also Brooks, honey, snap, honey.
Yes.
Circle, honey. Okay. Some of y'all too young to know what that is. Some of y'all too young to know about that snap. Okay. You are much appreciated, sis. Look, y'all check out Dr. Also Brooks. Hey, Houston family.
Yes.
I don't care if y'all on the other side of the H, honey.
Mm-hmm.
Let's look at how often. Look, how often do you visit your primary care physician? How often do you visit the doctor? Babe, y'all better make that drive.
Yes.
Honey, make the drive.
Mm-hmm.
Like she said, everybody needs to have a primary care physician, but you want a primary care physician that is genuine, that really cares about you before the dollar. Okay.
Yes.
And I wouldn't have her here, honey, if she was stuck on the dollar. Okay.
Exactly. Y'all know it. Yes.
Honey, she's a sister with a private practice. Mm-hmm. Okay. She take insurance too. Yeah. Let me just throw that out there, honey. She take insurance. Okay.
Yes.
So stay tuned. This would not be her last time here. I assure you all, this will not be her last time here. We do have a few minutes left. Are there any questions, like burning questions, y'all want to drop down there? I'm gonna try to read through some of these comments, but y'all go ahead. If you have questions, we got about I think this is about 4 minutes remaining before this thing cut off on us now. Okay. So if you have specific questions, be sure to drop them down there. Y'all definitely check out this Blissful Yoni herbal womb tea. Okay, to help with cramp relief. Okay, it ain't a cure, honey. Okay, but it can get us by. Okay, but don't be sipping on this tea with flaming hot Cheetos next to it. now, doctor done already told y'all. Okay,
go.
That y'all gotta switch that up. Mm-hmm. She just told y'all about how. Look here, they in 2 years. Okay, you out here trying to be a whole steer. with that cow's breast milk. Whole steer. Y'all better put that ice cream down, okay?
Yes.
Oh, I appreciate the love in the comments. She says medical. Okay, she says, let me see. I'm trying to read it because it's on your screen.
Oh yeah.
If you see anything, you can jump them in there.
So yes,
any fears keeping us silent?
Yes, fear keeping us silent. And
yes, so she said
fear, like we got to take care of ourselves. We have to make sure that, and we're advocating for those that we love. And so, yes, right. Keeping us silent, even just sometimes doctors being dismissive for things that they don't understand. Everybody's not a fit for everyone. I'll be the first. That part. So if you're ever going to the doctor and you're feeling like you're being shamed, if you're going to the doctor and you feel like you're not getting the answers that you need, and if you address that with the doctor, with the practice, and you're not getting the answer that you think you need to get, look elsewhere. Right. It's because it's your health. And when it comes down to it, if you are not taking a stand for yourself, nobody else is. So
Absolutely.
you have to just know, okay, this is a good fit for me or this isn't a good fit for me. And there's nothing wrong with making sure that you have what you need. Absolutely nothing wrong.
So I'll finish. I think so her quote was, her comment was, fear is keeping us silent and ignorance is killing us. So thank you for inviting the normality into this serious topic. Absolutely, Comedic Yogini. Hey, Eva Minty, I see you join, baby. Hello, hello. All right, let's see. Plant chick, so y'all hollered up for some of this plant-based lifestyle, honey. Okay, that's for her. Otherwise I'd delete it, okay, if she wasn't legit. Okay, but yes, absolutely. If you're interested in the plant-based lifestyle, Plant Chicks by way of Comedic Yogini is available for that. The doc also, honey, okay, sipping on that tea. That's right. Yes, yes. And we'll drop that link in there shortly. Okay, it's the monthly support. Hey, Cordell Paris, thank you for joining us, dear. Thank you for joining us. Hey, Ajwa, thank you for joining us.
Yes.
Oh, baby, y'all are in here tonight. The real.
Yes. Hey, Shara. Hey, Bianca. Thank y'all for joining.
Absolutely. Let's see. I don't see any questions down here, Doc. Do you? Because I don't want to look over anybody.
I didn't see any, but I appreciate the love. I see it. I see you.
Yes. Okay. Let's see. Great show. We have a great show here on the YouTube side.
Awesome.
Hey, Sand. What's up, mama? Okay. Well, look here. We like to thank everybody for joining us. Y'all are most appreciated. You are the reason that we're here, honey. I want everybody to make a commitment, though, before we go. Okay? Okay, I'm going to say, let's talk, and y'all say period, because I can't hear you. Got to type it in the comments, okay? Let's talk.
Period.
Type it, baby. Type period down there. Type period. Okay, everybody type period down there in the comments if you are still on this live. This is so important because, see, talking about our womb wellness, this has to become the new normal. This has to become the new normal, and it is why we are here. It is why Talk to Me Tuesdays, baby, are so important.
Yes.
Okay? It is so important. This way we can alleviate some of those stigma and taboos that are attached to who we are naturally. Okay, honey? Yes. Okay. So that's what's up with it. We're going to call it a night. Dr. Also Brooks, please let the people know one more time how they can get in touch with you and where they can find you, my dear.
I am at the Doc Also on Instagram and Facebook. And you can also visit the practice at benebeyond.com. That's BENE beyond.com.
All right. And you know your girl, honey. Y'all holler at your girl at @Empower You period on Facebook, Instagram, and TikTok. Okay, she on TikTok. I'm trying to work that out, so y'all just bear with me over there. And also hit your girl up. Subscribe to the website. Subscribe to this YouTube channel, honey, because yes, we are live on YouTube right now.
Yes.
Subscribe to the channel tonight. Subscribe to the website www.empoweryou.com. That is 3 words, not 1. 3 words all together. Okay, and definitely visit that. Hit up the store and order your Blissful Yoni Herbal Womb Tea. Okay, make a commitment to yourself to love yourself enough to do right by her. Okay, too often we walk around, you know what I'm saying, with expensive things on our arms, honey, and our attire on our feet, but seldom will we focus on our most sacred space. Okay, let's think about that now. That's a word. That's a word, honey. That's the word. Don't y'all be walking around here with $200 bags on your arms and $2 pads, and y'all over there eating off the dollar menu at McDonald's on a regular.
Exactly.
Okay.
Right. Mm-hmm.
So let's really take control of our health. Let's be mindful, and it's a wrap, y'all. It's a wrap, and we'll come back in again. If y'all have other comments, questions, hit your girl up. We're willing to do a part 2 to this thing.
Yes.
It's so much to be said about endometriosis. That we can really pick this thing apart and focus on various things. And in fact, let us know what else you want to talk about. Exactly. What else y'all want
on Talk to Me Tuesday. What y'all want to hear from the doc, honey? Because y'all know I got to bring her back. I got to bring Dr. Also Brooks back, okay?
Yes.
We in this thing together now. We have already, look, we be in these streets together. Honey, y'all missed it. We was out there in Houston. She was giving out free consults. Now y'all gonna have to pay.
Yes.
Y'all, hey,
Expo.
y'all gonna have to come on with them, honey. Okay. Yeah, we be in the streets together. We're now on live together, so you're gonna see a lot more with us. You know,
Yes.
honey. And let me go and throw this quick one out there too, honey. She got them look, girl, I about done lost my word. I got excited for a minute. Honey, Dr. Also Brooks carries those mommy to be boxes, honey.
Yes.
Over there at Benny Health, honey.
Yes.
Yeah.
I mean, you probably can't. Oh, they're out of view, but they
out of it's all right. It's all right because we're gonna come back. That's gonna be a whole nother segment. That's okay.
Yes.
So this was really good. This was really good. I'm out here to bring out people that you can relate to. And Dr. Also Brooks is definitely that. Like I said, she's the best of both worlds, and I just can't say it enough. I hope you all have enjoyed this. Okay, definitely press replay. If you can't get it over here on the Instagram side, tune in to us on the YouTube page, subscribe. Okay, I see you, Comedic Yogini. She said, Dr. Also Brooks, the sister said she'd like to hear about fibroids.
Oh, yes.
That's one of
we need to have that discussion for sure.
Yeah. So we'll definitely put that in the rotation. We'll definitely put that in the rotation.
Yes.
All right, y'all. Well, thank you again for joining us. We're out, honey.
Yes.
And remember, your commitment today is let's talk, period.
Yes.
Okay? Let's have the conversations, baby. That's how we're going to be preventive, okay? Okay? And this is how we can be intervention. Okay? Yes. Look, I say intervention. Y'all see how I made that up? Intervention.
We with you. We follow you.
Okay, you with me? Okay. Early detection is so important in a lot of the ailments that we experience as women. Okay, so that's what's up with it. We are out. Thank y'all for chiming in to Talk to Me Tuesday, baby. Until the next show, y'all stay tuned. I won't be back on next week. I'm gonna let y'all enjoy, your Christmas, your holidays, or your winter breaks and stuff. Next week we'll be jumping into Kwanzaa, honey, over here in my house, honey, in my house. Okay. But yeah, there will be an announcement of our next incoming. So y'all stay tuned. Subscribe, baby. Subscribe. And then you can stay connected. You ain't got to figure it out. We're going to bring it to you.
Yes.
All right. So that's what's up. Good night.
Night.
Good night, y'all. All right. Let's see. We're going to end video on the Instagram side, honey.
All right.
Thank you again, girl. You are so appreciated, man.
Oh, this was fun.
You over here raising the standards for these doctors.
Oh,
you are raising the standards for these doctors because a lot of us are, we're going into these, first of all, let's just talk about that space, honey. I wish we could just pick this camera up so they can really see. Honey, I mean, like walking in there, I mean, it's so woosah, honey. I didn't know if I was getting a yoni steam, honey, or woman wellness. I didn't know. I know I was ready though. I was ready, okay?
Yes. Well, I like it because it's one of those things that it immediately takes away the, I'm in a doctor's office. So.
Yeah, right. You see?
Yes.
Right on, right. I mean, and then just in addition to that, knowing what to be able to ask your doctor when you walk in. I mean, not when you walk in, but knowing what questions to ask when it comes to endometriosis. Helping these sisters really understand that, So that's what's up with it, my dear. We'll talk offline because, honey, we'll get going. We'll get going. Honey, we sit up here on the YouTube side, okay?
I know. So we'll have to talk about the next topic and all that good stuff. But I know you've been working hard, so time for you to
So I'm gonna look for the comments. I'm sure I'll get a couple of inboxes after this show, and then we'll be in touch on how we'll roll out next.
All right. Sounds good to me.
That's easy, mama. Much love always.
Thank you. Much love to you. I appreciate it. Bye-bye.